LifeScan Wellness Centers is the nation's largest provider of public safety physicals across the United States. In my 30-plus years as being a first responder and a leader within the fire service, I've never seen such tremendous focus on the health, wellness, and safety of our firefighters and law enforcement officers. LifeScan's proud to be a part of that and continue to grow and expand access to affordable care aimed at comprehensive approach to early detection. We know for first responders that cardiovascular events continue to be a leading cause of not only line of duty death, but permanent disability. On the cancer front, we know that nearly 40% of all members of the general public will, at some point in their life, be afflicted with and battle cancer in one form or another. Unfortunately, first responders have higher rates than that. On the behavioral health front, we have tremendous amount of behavioral health stresses due to repeated trauma exposure, and compounded over time, those take a behavioral health toll, whether that be addiction, sleep issues, post-traumatic stress, anxiety. On the far end of that spectrum is first responders' suicide. And behavioral health, much like our physical health, can be screened for, can be identified with early detection, and then early intervention is a key component to maintaining overall behavioral wellness of our first responders. What we've designed is a very comprehensive, integrated early detection exam that is focused on finding very early stages of disease processes to be able to manage them and intervene at the very earliest point so we can actually prevent tragic consequences. So by the time we see the first responder for their LifeScan wellness exam, we already have their comprehensive blood work back. They'll then spend 3 hours with us going through with an exercise physiologist, the 12-lead stress test, and other very detailed metrics looking at their physical wellness and fitness. They'll spend an hour with our ultrasound technician looking at the vasculature and organs. The last piece of the LifeScan wellness exam is an hour-long physical with our advanced registered nurse practitioner, who will actually do a head-to-toe physical, perform behavioral health and nutrition screenings, and any follow-up measures that need to be taken to assure that the first responders' health is properly managed and any risks are addressed. We also archive that information as part of their medical record, so we're able to trend the wellness of each first responder annually to assure subtle changes are indicative potentially of new onset disease are caught at their earliest phase for the most tremendous outcomes of survival possible. The affordability and ease of access of LifeScan physicals pales in comparison with what we know the cost is for later detection diseases and disease processes, notwithstanding the human toll and impact on not only the first responder, but the family and the department. We also would never think of not doing and investing in preventative maintenance for one of our apparatus or patrol vehicles. And for less than the cost of that in many cases, we would invest in the overall survival and wellness of our first responders through an annual LifeScan wellness physical. LifeScan Wellness Center has been and will continue to be a trusted partner with our public safety community to assure that we do everything to assure preventable risk is addressed, making an effort that every responder goes home safely at the end of every shift.